Hello everyone, my name is Cleo Navarro. My health topic is lung cancer and my target population is Asian Americans. This is my presentation on lung cancer amongst Asian Americans. So what is lung cancer? Lung cancer is a type of cancer that starts in our lungs. Human lungs are two spongy organs in our chest that take in oxygen when we inhale and we release carbon dioxide when we exhale. So our lungs are very important organs. Lung cancer is the leading cause of cancer deaths worldwide according to the Mayo Clinic, and smokers are the most vulnerable to developing lung cancer due to the toxins that are in cigarettes, and quitting smoking can reduce your risk for developing lung cancer significantly. Lung cancer can also occur in people who have never smoked before. The target population that I will be focusing on is Asian Americans in the US. The ethnic groups that make up Asian Americans are Chinese, Filipino, Indian, Korean, Japanese, and Vietnamese. These ethnic groups account for 85% of all Asian Americans in 2019, according to the Pew Research Center. The median age for the Asian population in the US in 2019 was 34 years old, and the median age for US-born Asians was 19 years old in 2019. The location for my target population is Asian Americans throughout the United States, and according to the 2020 U.S. Census, there was 20.6 million people who identified as Asian, Native Hawaiian, and or Pacific Islander, and this made up 6.2% of the nation's population. So my selected health problem is lung cancer and some epidemiological data to justify my selection for this health problem of lung cancer amongst the Asian American population, which is my target population, is according to the American Lung Association. Lung cancer is the leading cause of death amongst Asian Americans / Native Hawaiians / Pacific Islanders, according to 2022 reports, and overall Asian American Pacific Islander men had the third highest rate of new lung cancer cases after African American men and Caucasian men. This means that the rate of lung cancer is higher for Asian Americans compared to that of Latino and Indigenous American Indian / Alaskan Native populations. And also, according to the American Lung Association, there are many disparities between the sexes when it comes to lung cancer cases. For Asian American Pacific Islander women, they are much less likely to be diagnosed with lung cancer compared that to Asian American men, who are 62% more likely to be diagnosed with lung cancer. As for Asian Americans and Pacific Islanders, the lung cancer, their cases were 16% less likely to be diagnosed early with the disease, and they were 3% more likely to not receive any treatment for their lung cancer compared to that of Caucasian Americans. So the behavior that has the clearest association with lung cancer is smoking, and smoking increases your risk for cancer, stroke, and heart disease, and these diseases are the leading causes of death for Asian Americans. According to the Center for Disease Control and Prevention, about 1 in every 13 non-Hispanic Asian adults smoke cigarettes. That's about 8% who smoke. And amongst Asian Americans adults, cigarette smoking is more common in men than women. So there's definitely a disparity there because Asian American men are more likely to smoke than women. So the selected behavior change model and why I selected it. The behavior change theory that I have chosen to apply to this situation of smoking amongst Asian Americans is the theoretical model of behavior change, also known as the stage of the change. I chose this theory because for many smokers, they might be in the stage of contemplation, where they are acknowledging that there's a problem with their smoking habit, but they're not quite ready to quit yet, or they may lack the confidence to make that change of no longer smoking. But once smokers move to that stage of preparation and determination, they're getting ready to make that change, and they can be aided to make that change of no longer smoking by having a motivational interview with a trusted healthcare professional. Stage 3 of preparation includes researching. So this is the part where patients can speak with their doctors about possible methods of slowly quitting smoking, while also healthcare professionals can express their empathy and build a connection with their patients that can aid them in smoking, because motivational interviews are primarily focused on not being judgmental, so patients can share their story of why they started smoking and therefore can help them prepare to start that process of quitting smoking. I chose this theory of change because it applies to the stages a smoker might go through as they think about quitting. They then can move into the process of quitting, and once they have made that change through their actions and willpower, they are finally able to reach that stage where they are maintaining as they have stopped smoking. So my intervention, the intervention that I will attempt to implement to impact the behavior of smoking amongst Asian Americans in a positive way is implementing motivational interviews. Motivational interviews are a collection of strategies that clinicians and primary care staff use, and it helps patients identify and resolve any ambivalence in the daily health choices they make, and this method can be used for trying to quit smoking. Motivational interviews are focused in on being patient, direct, non-judgmental, and non-confrontational, and very collaborative with patients. This intervention of motivational interviewing can be done by various people, such as counselors, healthcare professionals and providers, and quitline coaches for smoking. Motivational interviewing focuses on helping patients explore and resolve any ambivalence and uncertainty about making a behavioral change, such as quitting smoking, and this intervention is usually used for people who are not ready to quit using tobacco. Some of the counseling techniques that will be used for this intervention is expressing emotions with patients, such as empathy and actively listening to them, reflecting and repeating back to what the patient said, and building up their confidence to quit smoking. Motivational therapy was first created to help those with alcohol addiction, and it was later adapted for use in ending tobacco use, according to the United States Office of the Surgeon General. And for my intervention, I envision a culturally tailored motivational interview-based manual as well. It can serve as a motivational communication manual in various Asian languages, and it can be developed to support adherence to various methods to quit smoking, as some of the important components of this motivational interview-based manual will be culturally sensitive and helpful in providing education about lung cancer to kind of make patients aware about the health effects of smoking, and various methods about ways to quit smoking. I'm trying to influence stage 3 of the theoretical model of behavioral change. It's the preparation and determination stage. For my intervention, this is during this stage of preparation, it's intent upon taking action for patients. So I feel that by patients having speak with their healthcare providers and having that guiding, motivating voice, it can help them prepare and take action to eventually stop smoking altogether. So some projected outcomes from this intervention. I expect the outcomes of this intervention to be positive. Various studies have shown that when comparing various smoking quitting interventions, the intervention technique of motivational interviewing was positive versus giving brief advice and or standard care for the treatment of tobacco use. Motivational interviewing, when used in 1 to 6 sessions, anywhere from 10 to 60 minutes, when delivered by clinicians in various settings such as primary care, hospitals, emergency care departments, military settings, community care, and via telephone quit lines, was shown to significantly increase successful quitting of tobacco, especially when compared to those who do not receive this type of motivational interviewing intervention. So another outcome I expect is if this intervention was implemented in various healthcare settings where there's a high population of Asian Americans, this would increase the likelihood of helping Asian Americans quit smoking, especially Asian American men, because they are more likely to smoke versus Asian American women. And as we know, smoking is one of the biggest behavioral behaviors that contributes to lung cancer. So, in conclusion, I feel that this intervention method, when delivered by trained counselors and clinicians, could be more effective in increasing readiness to help Asian Americans quit smoking, especially for Asian American men, as they are the group who smokes more than Asian American women. When compared to other intervention methods such as quick advice or standard care, motivational interviewing is effective for smoking cessation. So I believe that having motivational interviews as an intervention while using the trans-theoretical model of change, also known as the stages of change, could help motivate my target population in quitting smoking, therefore reducing their risk for developing lung cancer. These are my references, and thank you so much for watching my presentation.